Hey, it's Dr. Yazdan. This is a little bit more of a sensitive topic, but let's talk about hair transplant scams. We do so much hair transplant repair, and it sucks. And it's really nice to be able to fix things that went wrong, but they really shouldn't go wrong in the first place. And these are kind of the things that I tell patients to watch out for when they come in with for a consultation with me. And it's things that everybody should understand when they're doing their research. First things first is you want to make sure that the doctor's a hair doctor. You want to make sure that they've been doing this for a long time. Just because they say they're a hair doctor, doesn't mean that they are. If they're doing boob jobs one day and nose jobs another and hair another, they're not hair guys. So that's one of the biggest red flags that I tell patients. The second thing is you want to make sure the doctor is going to be involved in the surgery. That's really, really important because in a lot of practices, the doctor is not doing any of the surgery or they're doing barely any of it. There is a standardized care that's put out by the ISHRS, the American Board of Hair Restoration Surgeons, IAHRS, and all of them discuss the roles of a physician during a hair transplant and what doctors should be doing and what assistants or technicians are able to do. And those should be followed by doctors doing hair transplant surgery. And nowhere in that does it say that doctors can delegate making incisions to assistants, to extracting follicles, to doing anesthesia or design of a hair transplant. All of that kind of stuff should really be done by a physician, and this is something that is just common sense. The other thing is you want to make sure the doctor's actually there. We're going to do another talk about a doctor on the East Coast that got arrested last week, I believe, for selling someone a hair transplant and being at the hospital seeing patients while he had unlicensed people performing the hair transplant in an office. This doctor was a pediatric endocrinologist. I have no idea why a pediatric endocrinologist that went through so much training and residency would do something like that. It just makes zero sense, but this is what happens in hair, and this is why it's a dangerous field and why patients really, really need to watch out for things like this. The other thing that I tell patients is it's really good to see doctors that specialize in both FUE and strip, FUT. The reason why this is important is because if you go to the guys that just do FUE, they're going to tell you all this bad stuff about strip surgery and how terrible strip surgery is and the scarring and all this kind of stuff. And vice versa, if you go to the guys that only do strip, they're going to show you all this crazy stuff about FUE and tell you how bad FUE is. Well, none of it is really true. There's patients where they're very good candidates for FUE. There's patients where they're really good candidates for FUT. And there's patients that kind of fall in between both and are candidates for both. So somebody that does both surgeries can guide you into the right direction as to why one is better than the other for you. And that should logically make sense. I had a consultation with a patient yesterday. He wore his hair at about a 0 to a 1 clip. He saw 2 doctors and both of them recommended a strip for him. And that's crazy because a strip is going to leave a scar on the back of his head. And what they told him is that, oh, the scar is not visible, you're not going to see it, we close it with a special technique. That's all BS. Everyone closes with the same technique. Now, there are guys that are better at closures and there are guys that are worse at closures, but at the end of the day, any strip surgery performed is going to leave a scar. I don't care who does that closure. It is going to leave some form of a scar, and if you wear your hair short, that is going to be visible. And those guys were pushing strip on this patient who was completely not a candidate for it. So that's really why it's important to go to someone that does both. And by the way, just because they say they do both doesn't mean they do both. There's doctors in Newport Beach down the street from me that say they do FUE, but when you go in their office, all they want to do is push you on a strip. But they'll tell you they do FUE. They do not. You want to make sure on their social media, their Facebook, their Instagram, their website, that they are posting videos of themselves doing both of the surgeries and talking about it. That's super, super, super important. The other thing I think is really important is practices that just do one surgery a day. We only do one case per day. Why? Because that's all I can do. I can't do more than one a day, and I'm involved in all the aspects of the surgery, and that's very important, because if you're going to a practice that's doing 5 of these a day, obviously the doctor is not going to be able to spend the time that should be spent on you, and also the attention to the fine detail is not going to be there. And so, in my opinion, it's really important to see a practice that does one surgery a day. The other thing is, a huge red flag is these practices that are advertising these crazy graft numbers. We do 3,000 grafts, we do 4,000 grafts, we do 5,000 grafts, that kind of stuff. For the majority of patients, they do not have the donor density to support doing a 4,000 graft FUE or strip hair transplant. It can be dangerous, it can lead to serious surgical complications, and the reality is most of these guys offering 4,000 graft hair transplants are really doing 500 grafts. They're cutting all the grafts up, splitting them up, artificially increasing the number to some number, and then telling patients that, oh, you got 4,000 grafts. We get so many patients that come in, they're like, I had a 4,000 graft hair transplant and none of it worked, and my hair, looks terrible and I need it fixed. And I look at their post-surgery photos, because they'll show it to me. They'll be like, this is what it looked like after the surgery. And I'll look at it and it looks like a 500 graft transplant. I mean, and it's like terrible. And of course, I already know who they went to and that it didn't work and why it didn't work. So that, I think, is really, really, really important and a huge red flag. In an FUE, most patients, in my opinion, have a donor zone to support about 2,000, maybe 2,500 grafts safely. Outside of that, you start increasing surgical risks, and patients can have serious post-surgical complications. One of the other things I see a lot on the internet is people who are advertising themselves as, we're the biggest, we're the best, we're the biggest hair transplant clinic in the state. And if you have to advertise yourself as the biggest and the best, you are not the biggest and you are not the best. If you are the best, you don't need to tell people that. Michael Jordan doesn't need to tell people that he's one of the best basketball players in the world or in all-time history. People know Michael Jordan is one of the best, and it's the same with anybody else. So if you see doctors that are doing videos talking about how great they are, they're probably not that good, because if they were, they wouldn't be saying it. Lastly, it's practices that are advertising all kinds of off-label procedures. I see so many places that are advertising like scalp massages, scalp peptide, mask, these injections of just stuff, and none of that works. The reality is the things that work are very simple medical management that you can do yourself at home. PRP procedures by a doctor that knows what they're doing. Just because a doctor says they do PRP for hair loss, most of them have no clue how to do PRP for hair loss, and they end up causing more problems for patients. So if you see a practice that is advertising all kinds of treatments for hair loss, the reality is probably none of those really work, and I would steer clear of those, because I see a lot of patients waste so much money on all kinds of treatments. I went to this practice, they did this. I went to this practice, they did that. None of it worked, and in fact, my hair got worse. Those are red flags. And so again, if you're seeing practices advertising all these kinds of things, I would steer clear of that, especially if they're telling you stuff like, we're the biggest, we're the best. Because if you're the biggest and you're the best, you don't really care to talk about it. Everybody already knows that about you. I hope this helps patients. If you guys have questions, you can always reach out to us. We do virtual consultations. I talk to patients directly myself. I'm happy to talk with you and answer any questions you have. Good resources and good organizations for finding more qualified hair doctors, and the key word in that is more qualified. Just because there are in organizations doesn't mean they're necessarily great. It just means that they're better than the guys that aren't. But the two most credible hair organizations that I like are the American Hair Loss Association and the IAHRS. Both of those you can't really buy into. You can't really pay to play. You can't be, just call up and say, hey, I'll pay your fees and be a member. They're much more difficult to get into. Some of the other organizations, you can just fill out an application, send a check, and all of a sudden you're an accredited doctor on their website. Those are kind of scam, bogus organizations, and they do, a lot of patients get tricked by that kind of stuff. So I like the American Hair Loss Association and the IAHRS. Those are two that I like, but again, in there you're gonna find doctors that are really good and doctors that are not as good, but as a whole, you're probably gonna get a good assessment from doctors you find in those organizations. Again, if you have any questions for us, you can always reach out to us. We can do a virtual consultation. I'm happy to see you and happy to try to help you with your hair loss. Thanks again for watching.